Hi, my name is Joel Guarna, and I'm here today to talk to you about sleep hygiene. I will provide a brief rationale for how to use sleep hygiene and then some tips for how to implement. So, as a physician, you'll often encounter patients who are talking about having disturbed sleep or insomnia. It's a pretty common complaint. Often these patients are coming in with a fair amount of distress, and what they're really looking to do is have greater control over their sleep. This is immediately a little bit tricky because if you think about what healthy, normal sleep looks like, it doesn't really entail control. It's just part of a sort of a normal daily rhythm where you get tired at night, you fall asleep easily, if all goes well, sleep enough, get enough restorative, high-quality sleep, wake up feeling more or less rested. And when that's disturbed, unfortunately, it doesn't naturally resolve in some cases. And so sometimes you're in a position of needing to intervene. Well before prescribing medications, it's always worth looking at some behavioral options that can work quite well. Now, I think about sleep hygiene as being just one part of an overall package. You may know about cognitive behavioral therapy for insomnia, or CBT-i. I think about sleep hygiene as being sort of the base or the foundation of CBT-i. It's the least intrusive intervention and often what you can start with because, frankly, sometimes you can get good results just from doing the sleep hygiene. Now, one of the problems with sleep hygiene is that if you look at a list of the different features of sleep hygiene, it often reads kind of like common sense. And so what that leads to is that many patients will minimize the importance of it. And I think some physicians and healthcare providers also minimize the importance of it inadvertently. And so what often happens is a person comes in, has problems with insomnia, and what we do is we counsel them or we educate them on some basics of sleep hygiene. Things like not taking naps, going to bed at the same time, making sure that your bed is comfortable and dark and cool and that sort of thing. And again, these are all make sense, these are all worthwhile, but we act as if it's really a matter of just getting the information from our head into their head. Or, I think even worse, just handing them a handout and hoping that they'll go home and read it. And again, if they just know the right things to do, they'll do it. I think in some ways we don't make the same mistake when it comes to something like physical therapy. We know that if someone understands how to do a physical therapy exercise, that is not enough really to make any difference. It's not going to improve their functioning, their range of motion, their conditioning. We know that it's really more a matter of having good form, practicing that with some significant repetition, and that's really where you get the benefit from. And so I would encourage you to think about sleep hygiene being like that. Even though it seems like common sense, and people will often nod their heads as you describe the different features, what you'll often find if you assess more carefully is that people aren't really doing good sleep hygiene. So there's a pretty big chasm between knowing about it and actually doing it. Using a tool like the Sleep Hygiene Index is a good start. You can find that online. I'll also include references at the end of this video. So using the Sleep Hygiene Index, and again, the versions online will help you score and get against norms and have some sense of, how much this might be an area worth working on. I personally use it more as a clinical tool, looking for where people are not quite arranging their sleep environments or their daily rhythms in a way that is conducive to sleep. So, completing a measure like the Sleep Hygiene Index will often give you some clues about where to start. I use a version that I made up myself. It's more of a worksheet. I'll also make sure that I include a PDF of this that really kind of breaks it down item by item, looking for where people might need some help. So it asks questions like, how much does your bedtime vary? Or how long do you stay in bed after waking? Has people report how they're doing. Then it includes a couple columns where it describes sort of better and worse practices for having good sleep hygiene. And then it has a fourth column that describes, okay, what is your goal with regard to this? For each feature of sleep hygiene, it asks them to assess, to compare to better or worse, and then also to look at what they could work on. So one way that you could use this in a clinic is you could pick out maybe 2 or 3 different items, have patients commit to making some changes, and then have them report back to you in 2 or 4 weeks or whenever you're going to see them again, see how they did, look for obstacles, and then coach them on better and worse practices. And over time, you'll be able to get their sleep hygiene to a better place. If their insomnia persists, you might escalate and use other aspects of CBT-i or make a referral or consider medications, but I think it's good sound practice to start with sleep hygiene.